1. There is an astonishing clinical reality that leg weakness and walking instability past age 60 represent zero natural parameters of chronological aging, but a silent biological deficiency in 3 core vitamins your physiology strictly requires before bedtime to actively rebuild lower extremity strength. When these vital nutrients are neglected, muscle masses fail to recover, neural pathways fracture, and your risk vectors for dangerous residential falls multiply threefold. Today, I will expose the definitive nutritional blueprint regarding these inexpensive vitamins and deliver the synchronized lifestyle protocol at home to successfully restore your posture, ensuring robust structural leg stability and absolute independent mobility across lifespan. The primary metabolic error past age 60 involves submissively assuming your physiology remains intact before severe pain erupts, leaving age-related sarcopenia to unchecked erode your calf muscle fibers every night. Widespread older adults chronically suffer from nocturnal muscle cramps and buckling knees upon standing without ever realizing that the protective myelin sheath wrapping around their lower limb nerves is heavily damaged by micronutrient deficits. Neural signals expanding from your cerebral cortex become completely strangled, entirely freezing your central capability to regulate dynamic physical balance metrics during daily walking paths over time. Strategic vitamin category number 3, engineered to actively initiate lower limb regeneration, features vitamin B12, specifically the premium bioavailable methylcobalamin form. Navigating past the critical 60 milestone, your gastric mucosa experiences a severe drop in hydrochloric acid production, rendering your digestive tract completely powerless to extract B12 from whole foods like eggs or salmon. This deep systemic deficit fractures your peripheral neurovascular signaling networks, launching chronic foot numbness, needle-like tingling sensations, and severe calf stiffness that heavily diminishes your stride length metrics over chronological lifespan. Because your central nervous architecture executes its primary cellular self-repair and nerve tissue reconstruction during overnight sleep cycles, administering your B12 dose before bed delivers maximal clinical efficiency. If you find these medical insights truly meaningful, please click like and subscribe right now to motivate our team in producing more valuable health videos for everyone. Utilizing a sublingual tablet under the tongue allows active compounds to bypass the gut and dissolve directly into your circulation, completely neutralizing catastrophic walking instability vectors. Strategic vitamin category number select, occupying the second spot within our metabolic protocol, features natural vitamin D3 calcifying. Over 70% of older adults suffer from severe D3 deficiencies because aging skin experiences a 75% drop in its biological capacity to synthesize nutrients from sunlight exposure alone. Vitamin D3 goes far beyond protecting your skeletal axis from dry, friction, osteoporosis. Its primary clinical purpose activates internal muscle receptors commanding quadriceps and gluteal functional strength, aggressively stimulating muscle protein fibers synthesis overnight. When systemic vitamin D3 parameters drop heavily, your muscle fiber remodeling freezes, expanding toxic visceral fat infiltration while triggering deep aching sensations inside your thighs and burning calf muscles. Consuming your D3 dose before sleep aligns perfectly with your overnight growth hormone release to completely extinguish chronic low-grade microvascular inflammatory fires, maximizing walking velocity scores, enabling older adults to leave chairs with a tall, upright posture without relying on physical canes. Your clinically sound lifestyle option, Band-Aid supplementing with a standardized dose of 2,000 to 4,000 IU of vitamin D3 every evening. Because this represents a fat-soluble active compound, utilize a premium soft gel capsule synchronized alongside a minor quantity of healthy dietary lipids like extra virgin olive oil or a small slice of ripe avocado. This precise timing protocol opens your small intestinal microvilli membranes, allowing the rich fluid nutrients to absorb gradually into your bloodstream. the reigning champion occupying vitamin category number 1 inside our lower extremity rehabilitation blueprint features organic vitamin K2, specifically the highly bioavailable MK7 configuration. A critical mechanical error among older adults involves consuming calcium supplements and vitamin D3 completely in isolation. Severe K2 deficits leave circulating calcium molecules in a state of total mechanical misdirection instead of migrating into your skeletal bone matrix. Unguided calcium deposits inside your soft tissues, hardening your carotid paths and calcifying knee joint spaces. Vitamin K2 operates precisely like a master metabolic traffic controller, actively prompts the functionality of osteocalcin proteins to gather and anchor free circulating calcium straight into your skeletal structures. This mechanical sequence entirely lifts destructive mechanical shear stress, straining your dynamic capillary networks, successfully blocking remote risks of sudden femur fractures driven by bone density loss. Concurrently, K2 repairs muscle cell membranes, restoring robust contraction durability to your thighs and gluteal muscle masses. Advanced clinical documentation reveals a spectacular reality. Patients supplementing with vitamin K2 before sleep show profound stabilization over glucose metrics by expanding visceral fat clearance parameters. Active K2 completely replenishes muscle glycogen storage throughout overnight hours, effectively shattering cellular insulin resistance loops inside your peripheral frameworks, entirely removing chronic metabolic workload that destroys your internal liver tissue compliance over chronological time across lifespan. Your primary management step mandates integrating a dose of 100 to 200 micrograms of vitamin K2 and K7 roughly 30 minutes before bedtime. Please click like, subscribe to the channel, and drop your personal health updates in the comments below to motivate our upcoming clinical lessons. Coordinating your K2 dose synchronized alongside vitamin D3 builds an unyielding multi-layered weapon reinforcing bone density. Establish your explicit bedtime timeline protocol managing all 3 vital micronutrients synchronized inside your comfortable bedroom corridor framework daily, exactly 30 minutes before closing your eyes. Position your sublingual B12 tablet under your tongue to let it dissolve naturally straight into your circulation system. Simultaneously, swallow your vitamin D3 and K2 soft gels paired alongside a tiny piece of raw walnut to serve as your organic lipid solvent, opening intestinal absorption channels. The tragic reality inside unfeeling commercialized medical frameworks involves the complete absence of clear communication revealing the self-repair capacity of these dirt-cheap micronutrients. Millions of aging demographics perform high-intensity training regimens when their cellular matrices suffer severe bioenergetic starvation, aggressively inducing dry, friction bone erosion inside knee joints while compounding mechanical shear stress, destroying carotid paths behind the neck. Auxiliary action blueprint number select to safeguard your lower limbs introduces your structured intentional hydration protocol utilizing warm water daily. Chronic cellular dehydration thickens your circulatory fluid volume while transforming knee joint lubricating synovial fluids into dry, sticky substances. Absent of clean water volumes, vitamin B12 fails neural conduction, while D3 and K2 completely lose their capacity to guide calcium. Sip warm water distributed every 90 minutes to fully open channels. Your mandatory lifestyle rule requires stopping your fluid intake roughly 1 hour before bedtime to thoroughly protect undisturbed slow-wave deep sleep phases. Simultaneously, entirely crush the hazardous habit of consuming refined carbohydrates like white rice, white bread, or sugary desserts after 7 p.m. Eating heavy late meals forces your digestive systems to execute aggressive mechanical contractions overnight, draining clean oxygen volumes away from nourishing lower extremities. Auxiliary action blueprint number 3 introduces your stationary cough raise routine for 15 minutes right before your bedtime schedule. This seated movement intensely activates your lower leg soleus muscle, the singular muscle mass automatically drawing circulating glucose directly from your bloodstream to burn for physical fuel independently without requiring insulin keys, drawing chronic hemoglobin A1C down while liberating your liver structures from fatty liver paths. This gentle home-based heel-raised drill never overloads or articular cartilage structures inside knee joints. It functions exactly like a secondary hydraulic peripheral pump, aggressively draining trapped venous blood volume straight out of your lower limbs, pushing the nutrient-dense fluid stream back up to flood your system with clean oxygen, directing vitamins B12, D3, and K2 to rebuild muscle fiber bundles overnight, to shield your neurovascular architecture from advanced carotid artery plaque ruptures. Implementing a functional medical communication protocol during routine checkups is mandatory. Never enter hospital facilities passive, surrendering your biological destiny. Candidly demand parameters identifying your carotid and intimomedial thickness IMT profiles via duplex ultrasound scans behind the neck to fully expose underlying fragile atherosclerotic plaque aggregations expanding inside your vessel walls over lifespan. Request structural brain evaluation via high-resolution MRI scans to expose quiet white matter degradation and silent lacunar infarct scars expanding inside your deep cerebral cortex frameworks before devastating stroke complications erupt. Please subscribe and like this video right now to join us in spreading authentic, meaningful healthcare solutions across the community. Modifying your home lifestyle early perfectly preserves your intracranial white matter architecture across aging. A tiny lifestyle medical intervention delivering exceptional vascular protection. Metrics involve securing a personal blood pressure monitor right at home. Self-logging your blood pressure metrics every single morning upon leaving your bed exposes real-world fluctuations, charting your systolic blood pressure metrics early in the morning weekly, extinguishing sudden hypertensive pressure surges. Synchronized alongside your nighttime nutrient restoration, completely shatters remote early morning blood clot aggregation risks. The core principle older adults must firmly memorize is the long-term biological accumulation effect of subtle metabolic errors. A minor nutritional mistake, like consuming a sweet cereal bowl close to bedtime or neglecting soluble fibers during early hours, never triggers acute cognitive collapse or leg immobility inside a resilient 30-year-old physiology. However, when your framework navigates past the critical 60 milestone, your internal metabolic regulation and vascular compliance have already dropped heavily due to chronological aging. The true clinical power to shield your vascular lumen resides entirely inside your consistent daily discipline over small nutritional habits at home, completely calming cellular insulin resistance from the foundation. Widespread patients dangerously delay lifestyle modifications, waiting until severe metabolic complications erupt into total bedridden immobility before panicking and seeking heavy chemical prescriptions, hacking toxic side effects, destroying renal filtration health. This represents a form of hazardous vascular suicide over lifespan. The compounding effect of a small habit extending from day to day creates a highly powerful anti-aging clinical intervention over time, successfully preserving the non-stick integrity of your microvascular networks, nourishing your muscle membranes and brain. A sharp cognitive mind, free from fragile plaques and complete physical independence represent your most priceless biological assets to thoroughly enjoy your peace and happiness alongside family past age 60. Your primary, actionable management step to clear dense visceral fat layers wrapping around your liver requires completely crushing industrial ultra-processed packaged items containing toxic chemical emulsifiers, shifting toward a medically sound whole food and Mediterranean diet built around fresh avocados, raw walnuts, extra virgin olive oil, and wild salmon. Salmon entirely removes chronic metabolic shear stress, destroying your target tissues over chronological aging patterns. Comprehending today's complete synchronized metabolic lifestyle prescription equips you with the clinical weapon to assume absolute autonomy over your healthy longevity path. I am Dr. Elias Thorne from the trusted global healthcare organization Boston Community Health. Our professional mission will consistently remain here to deliver the most honest, international evidence-based critical lessons, exposing corporate medical loopholes to successfully sustain your physical freedom and independent living over lifespan. Evidence-based medicine delivers an aggressive biological warning, the entire synchronized clearance of metabolic toxins and nerve fiber repair never unfolds while your physiology is actively processing midnight carbohydrates. Your circulation exclusively executes these regenerative biological processes when sympathetic nervous states are deactivated, with your framework melting into nocturnal deep sleep hours with an empty stomach environment. Finalize your light protein dinner timeline before 7 p.m. to open blood flow channels, performing slow-seated leg extensions near your bed frame or executing gentle ankle circles right before sleep hours never overloads your joint cartilage sheaths like heavy gym workouts. This targets triggering active micro-movement signals expanding from your lower limbs, instructing your central nervous system to identify coordinates, prioritizing rich oxygenated blood volumes and vitamins B12, D3, and K2 straight to flood your muscular framework during rest. When microscopic vessel networks nourishing lower limb nerve fibers are completely liberated from the oxidative strain driven by chronic systemic inflammatory cytokines, which oxygenated blood parameters concurrently travel fluidly up through your carotid pathways to nourish the cerebral cortex and retina. This biological sequence permanently shields your intracranial white matter architecture and hippocampus against silent lacunar infarct scars, sustaining your absolute physical freedom and peak cognitive sharpness across lifespan, reclaiming absolute physical freedom to walk using your own legs alongside a sharp cognitive mind completely free from fragile plaques operates as your most priceless biological asset past age 60. Never allow silent micronutrient starvation to unchecked freeze your dynamic cellular self-repair metrics. Fully supercharge your brain cells and lower extremities starting tomorrow morning through utilizing authentic, international, evidence-based geriatric knowledge, successfully breaking the neurodegenerative cascading loop forever. Never gamble your dynamic physical independence on hazardous structural late carbohydrate-heavy meals repeated across chronological daily life. If today's lesson brought immense value to your health, please click like, subscribe to Boston Community Health, and comment your preferred vitamin choice tonight below so we can expand this wellness mission together. Wishing you continuous health, robust physical freedom, and absolute cognitive clarity across lifespan.